8-hour time restricted eating linked to a 91 higher risk of cardiovascular death. What the heck? This sucks. Now, this was released a few days ago on the 18th of March 2024. And if you are watching this video now, it might have been some days, weeks, or months by then. And this publication by the American Heart Association has caused a lot of confusion and doubt in the medical world, and especially fear for those who do intermittent fasting. And that is what this is all about. Meaning intermittent fasting increases your risk of a heart attack death by 91%. Now, I'm careful not to use the word study, so let's just go with a publication, okay? And it is actually an abstract of an observational study sponsored by the American Heart Association and not experimental or peer-reviewed. So I want us to clear the doubts and the fears and also give you credible experimental studies which were peer-reviewed that pretty much says the opposite of this new finding and the benefits of intermittent fasting as far as cardiovascular health is concerned. First of all, what is intermittent fasting? It is an eating pattern, that is a time-restricted eating pattern involving limiting the hours for eating to a specific number of hours each day, which may range from a 4 to 12-hour time window in 24 hours. And many people who follow a time-restricted eating diet follow a 16-8-hour ratio eating schedule, where they eat all their foods in an 8-hour window and then fast for the remaining 16 hours each day. Here are a couple of the highlights from the website concerning this new publication. A study of over 20,000 adults found that those who followed an 8-hour time-restricted eating schedule, a type of intermittent fasting, had a 91% higher risk of death from cardiovascular disease. Then it says, people with heart diseases or cancer also had an increased risk of cardiovascular death. Then compared with the standard schedule of eating across 12 to 16 hours per day, limiting food intake to less than 8 hours per day was not associated with living longer, and this is ridiculous. Again, it says, even though this type of diet has been popular due to its potential short-term benefits, our research clearly shows that compared with a typical eating time ranging from 12 to 16 hours per day, a shorter eating duration was not associated with living longer, and that is also ridiculous. First of all, let's begin by pointing out that this is not a peer-reviewed article in a journal. It is a poster presentation which has its importance in the scientific community as the beginning of a conversation and not the conclusion of a conversation or a conclusive answer. It also goes to say that the study's limitations included its reliance on self-reported dietary information which may be affected by participant memory and recall and may not accurately assess typical eating patterns. Factors that may also play a role in health outside of the daily duration of eating and cause of death were not included in the analysis. So it is actually an observational analysis based on questionnaires that this study subject answered, and what they asked was that over the last 2 days, what time frame did you eat? Looking at those who kept their eating window 8 hours or less, or 8 to 10 hours, or even 12 hours and up to 16 hours. And once they had the data, they cross-checked with the registration of death at the end of 2019 to see if these people died, and if they died, what was the cause of their death from the registry. So it is based on a 24-hour dietary record, having the participant remember what they ate, and you and I know that that will never be accurate. And the data they came out had a lot of loopholes. For example, a lot of these participants were heavy smokers, about 27% compared with a reference rate of 70%. And that is a huge discrepancy. And smoking, you and I know that is heavily linked to cardiovascular disease and death. So who says the smoking couldn't have caused the death rather than the intermittent fasting? What their data also said is this: if you had the eating window of less than 8 hours, you were 26% more likely to die of all-cause mortality. Now, this could have been a sensational news, but they chose the cardiovascular data to say that if you ate or had an eating window of less than 8 hours, then you were 91% likely to die of a cardiovascular disease. There are other factors they missed, so this observational analysis has a lot of loopholes, though it is a starter for a serious conversation and experimental analysis to come up with a definite conclusion or answer. Having said that, now let's look at some benefits of intermittent fasting, peer-reviewed, and the impact on cardiovascular health. One study said that long-term effect of time-restricted eating with resistant training significantly decreased body mass fat mass and decrease inflammation, increase insulin sensitivity, and maintain a more balanced lipid profile with no adverse effect for improving cardiovascular health. Another research said that time restricted eating on body composition and cardiovascular risk significantly decreased waist circumference and also had a decrease in cardiovascular risk. Then another one said that a systemic review on intermittent fasting with cardiometabolic risk factors reduces significantly body weight circumferences, fat mass, blood pressure, and decrease in bad cholesterol and triglycerides, fasting insulin levels, and improve insulin sensitivity. And lastly, for breast cancer survivors, there was a decrease in cardiovascular risk, decreased risk of visceral adipose tissue. So in conclusion, if you are watching this video, share with your loved ones who do intermittent fasting, especially those who are obese, overweight, have metabolic syndrome such as blood pressure, diabetes, high cholesterol, that they don't have to worry or have fear of doing intermittent fasting. And since we are talking about cardiovascular health, if you haven't seen this video, I put it right here, check it out. And hey, always remember that God wants you healthy. Your health, your life.